All right, and now we are going to switch gears and talk a little bit about the placenta and the umbilical cord. So the main focus of this course or the similar courses is usually in the fetus and fetal anomalies, but it's very unfortunate that the placenta and umbilical cord are left behind, not just during these educational events, but also during everyday practice. Then we are looking at the pregnancy. And I think that the placenta, this is forgotten organ that fortunately lately got a lot of attention from researchers and practitioners. And I would like to share with you our experience in the evaluation of the placenta and highlight the new emerging ultrasound method that allows us to look deep inside into details of the placental function and the evaluation of the placental structure. And first, we're going to talk about the placenta. So the role of the placenta in function of the placenta is really critical for the normal development of the pregnancy, and indeed it serves as the interface between the maternal and the fetal circulation. It plays the critical function, including the delivery of the nutrition and exchange of respiratory gases, and also serves as the endocrine organ. And we all know, and it's a lot of evidence in the literature, that impairment in the placental development or function has a profound impact on the pregnancy outcome. Also, very interesting data is accumulating in the literature that suggests that the placenta plays a critical role in the future health of the individual, that the adult onset of the cardiovascular disease can be connected and related to the abnormal placental function during the pregnancy. So the abnormal placenta development in early gestation is associated with the maternal and fetal poor outcome, including preeclampsia, preterm delivery, and the growth restriction. But there are many others that also can be attributed to that. So here is just the schematics of our understanding how the placental dysfunction may impact the pregnancy, and usually believe that the very early pregnancy, if insult in the development of the placenta happens, that potentially may result in alteration of the placental development and subsequently placental function that later in pregnancy will result in the pregnancy complications and contribute to the poor